Did you know that January is Cervical Cancer Awareness Month? And here today to educate us on this important topic is Dr. Karen Zeb-Pollock. She is from St. Mark's Hospital. Welcome to the show.
Thanks so much for having me.
So this is something that maybe people have heard of. You've talked about cervical cancer, but you don't know who it impacts. Who are we talking to today?
Well, that's a great question. Cervical cancer really is not that common in the United States. It's the bottom part of the uterus, and really only 11 or 12,000 women across the country get it a year, but about 1 million women will have severe precancerous changes that lead to needing multiple procedures, taking portions of the cervix to prevent the cancer, and that can really compromise fertility. And it affects, of course, women, but the virus that causes cervical cancer is very, very common, and it affects men as well. So it's something that affects more cancers as well as cervical cancers.
Does abstinence prevent cervical cancer?
Well, cervical cancer is caused by a virus called human papillomavirus, and it's very, very common. 80% of sexually active adults, so nearly all of us in the United States and across the world have had this virus, but most of us clear this virus. And so we really cannot prevent obtaining it in the past, but now we can actually not only prevent it from not having any contact, but prevent it with the vaccine as well. But abstinence isn't an entire solution on its own because it can be transmitted not just from sex, but contact of genitals between men and women without sex.
Are there symptoms of cervical cancer that people notice?
Cervical cancer, often when it's caught early, is very silent. We pick it up by pap smears, and it's still very important to get pap smears. Some of the recommendations have changed, so it's important to ask your gynecologist what's appropriate for you. But when cervical cancer progresses, it causes bleeding and pain that is outside the norm for women that have periods or after menopause. Any bleeding is not appropriate.
All right, let's talk about prevention. What can our viewers do?
Oh, prevention these days is so radically different than what we had in the past. We used to prevent it just by finding it in its precancerous changes and doing lots of interventions. Nowadays, we can prevent it with the vaccine. We give vaccines. It's recommended at 11 to 12 for both males and females, boys and girls, just part of the pediatric onslaught, I'm afraid, of different things. It's 2 doses of a vaccine that, aside from being a little sore in the arm, really has no side effects and has been exceptionally well studied and is very, very safe and is almost 100% effective.
I know there used to be 3 doses, and
there
we
used
were
to be
thrilled
3
at my house that there
exactly.
are now.
If you get it done before 15.
Yes, 2 teenage daughters.
Exactly.
So they both had it done. How long do the effects last if you do get that shot?
We think they probably last your whole lifetime. We don't need any boosters after it's been administered, and ideally it's administered before any sort of exposure occurs. It's actually recommended that women and men who haven't had it can catch up to the age of 45, and that's something to talk about with primary care as well.
And then after 45, what would you do for prevention?
Well, that's a great question. Prevention will always still be important with pap smears. We don't have the data to say that after 45 vaccines will be helpful, but even before 45, pap smears to look for changes and to follow up on those will remain important for decades until we can really achieve that 100% vaccination rate.
If you'd like more information, everybody, St. Mark's is the place to go. That is their website. You're looking at it right now. You can also go to our website, and we'll link you for more information, abc4.com/midday. Doctor, thank you so much for being on the show.